My name is Hannah Ngo.
My name is Gwen Mills. My name is Ezekiel Lopez.
My name is Deanne Ngo.
I'm Joy Strange.
My name is Sharon Yang.
And this is our design proposal for the Dignity Health Methodist Hospital in Elk Grove. So the number one thing we had to keep in mind when designing this proposal were the current problems that many ERs and hospitals face that could potentially be fixed with some simple design enhancements. So the problems that we came up with were congested hallways, slowdowns in cleaning and prep time in rooms between patients, and also inadequate staffing during peak busyness for certain departments.
This emergency room is going to be built in Elk Grove with a growing population of 178,000 people. For such a large population, we have designed a large emergency room with at least 30 treatment rooms to accommodate.
Some solutions include wider hallways, so these will be about 2 meters wide so that we can have enough room to line up beds and also still have enough mobility in each hallway. Additionally, we're going to have extra nurses that are going to be able to move between not only the emergency room like main areas such as triage and also fast track, but also we'll have the flexibility to move between other parts of the emergency room as well. And our final and our main innovation is going to be a conveyor belt hospital bed.
In all rooms, there will be a conveyor belt hospital bed implemented, which can switch hospital bed sheets themselves and raise and lower the patient's head and feet according to the patient's preference with a remote control. The nurse may change sheets when needed, but will have to do so much less than with normal hospital beds. This saves both time and the patients from potential infections that can be found by prolonged use of the same bed sheet. This addresses the huge problem of the slowdown with cleaning and prepping rooms, as the nurse can change sheets with just the click of a button. It also makes the entire process of treatment faster without the need of nurses to move patients in their beds themselves, which is a tedious and time-consuming process.
So for the overall layout of the emergency room, each department is interconnected by the main corridor, which allows for an ease of access for both staff and patients, and it eliminates the wasted time for emergent cases to receive their required care. We also have ambulance bays according to their respective departments. So the one connected to the general ED would typically take in patients with physical injuries and would otherwise need immediate care. And the one connected to the mental health area would serve for patients who may prove to themselves to be a danger to themselves or to others and otherwise need to be isolated or cared for. So we also have many exits and entries in and out of the hospital. We have one entryway going through the front of the emergency room, which goes through the waiting room. And we have two, which are the ambulance bays, but only medical personnel and those receiving immediate care from the ambulances are able to go through here. We have one exit going through triage, one going through fast track, two going through radiology, two going through the infectious diseases department with one going through the sterile green zone or the staff zone, and one going through the storage area. And we have one adjacent to a ambulance bay in the mental health area and one going through the main corridor which enters into the main hospital.
So here we're going to start by entering into the emergency room, and from here the first thing that we're going to want to do is scan the QR code. So it's going to be the fastest and the easiest way for us to check into the hospital. And so the first nurse station that we're going to look at here is the bypass nurse, which she's going to have a really easy access into her nursing station. And then we're also going to have our regular nurse check-in here, and it's going to have a sign so that we know clearly where to go to check into the emergency room. Additionally, we're going to observe that we've made a separate seating area for not only those waiting, but also for their families so that they have comfort while they're waiting. Additionally, we have a total of 5 triage rooms. So the first will start on the very left, and it'll move to the right from there. So the room on the left is also our bariatric triage room. And then from there we have triage 2, 3, 4, and 5, which 4 and 5 are located through the hallway. And so we're going to notice here that the layout of the emergency room is going to be consistent throughout the hospital. And this is going to consist of one main nursing station in the center and a racetrack layout. So the hallways will be sectioned off across the sides of the nursing station in the center, as well as each of the patient rooms will be on the outside. We've also included a separate storage closet for our triage area, just for ease of access to supplies for triage. Additionally, this is going to be our triage room 5, and number 4 is right next to it. We've also included an exit next to triage and wider hallways, as we mentioned earlier.
So first we can enter the fast track area from the main corridor, and this corridor is really wide so that it avoids congestion, and a lot of other patient beds can be fit in it if need be. There's our first specialized procedure room for any operations from anyone from the fast track or the main emergency department. There's a medical storage equipment, and then there's a total of 5 fast track rooms, and we just passed 2. There's another one. We can also transport very easily people from the triage area into the fast track area because they're directly close to each other. And there are 2 other fast track rooms there. And here's our main fast track staff, and they're situated in the middle like a racetrack layout, with the rooms being the track itself. And in addition to that main staff area, there's 2 other flex staff between the fast track and also the main emergency department. So these people can work in both fast track and the main emergency department and change in between if there's ever a rush hour between the fast track or a lot of people in the main emergency department. So if they ever need any assistance, you can always flex easily between those. And you can move directly to the main emergency department from the fast track area through the hallway. There's a total of 9 treatment rooms, and there's the ambulance bay for the main emergency department. This is our main staff area for the emergency department, but they are also able to receive a lot of help from the flex staff between the main emergency department and the fast track. We have 2 resuscitation rooms in the main emergency department and a total of 9 treatment rooms with all standardized equipment and layout, and also a bathroom for staff and families, and also for patients as well, those that can be transported. And again, these treatment rooms are situated in a racetrack layout so that the staff can easily move between them and get a good feel for where everyone is. Here's an ambulance bay on the side there. There is a toilet. You can enter the mental health area from only the main emergency department. There's an ED recovery area. We also can follow and find a lounging area for staff and also for families and patients themselves as well. And here's another eating disorder recovery room. And there's a total of 12 mental health rooms that all have standardized equipment. And here's a support area for patients as well, where they can unwind and safe at the same time. There are also the rooms situated in a racetrack layout, again with the staff being in the middle. There is a large area, especially since there are 13 rooms, so we accommodated more staff area to the amount of rooms that are in the mental health area. And here is another ambulance bay, but it's specific to only mental health. We can access back up into the main hallway by passing through the mental health area.
So down into the main corridor from the mental health area, we can reach the radiology department, and the radiology department is easily accessible by both the general ED and the fast track area, so it is easier to transport patients in and out for scanning. So starting here from the entrance of the fast track area, we have a supply closet, and down here we have a support room, and over here we have a gowned imaging area with a dressing room. And over here we have a ultrasound scanning room, and in the middle here we have a nurse work area or staff work area. And over here we have a soiled utility room to disinfect all soiled patient items. And down here we have a imaging protective equipment area, as well as a CT supply closet. And over here we have a CT comp area, as well as 2 CT scanning rooms. And we also have a CT control area. And down over here, we have a radiology area with 2 radiology scanning rooms, and the radiology department can be exited back into the main corridor.
So now we're going to be entering the COVID-19 or outbreak specialized unit. We're going to be entering through the yellow zone where patients are going to be transported for tests. Staff in this area are required to wear a mask and gloves, whereas patients are going to be expected to wear masks. We have hall monitors to monitor the yellow zone to prevent clinicians from the red zone from entering the yellow zone. We have 4 rooms with specialized preoperative scanning, such as the chest CT scan for patients who are in need of an emergency surgical procedure. Then we have the red zone. The red zone is for patients who have tested positive for COVID-19, and this is where they're going to be undergoing treatment. There is a PPE room for staff, and this is before they enter the red zone so that they can protect themselves from self-contamination. We have 3 rooms with respiratory split sections so that patients with and without respiratory symptoms can be split up to prevent the spread of the disease. Then we have the green zone, which is only for staff. Staff must be screened before they enter this zone. Patients are not allowed in this zone because this is solely for administrative work and also breaks. We have an exit so that staff can exit the hospital without having to walk throughout the entire ER because this is a specialized unit. Having a specialized unit allows for focused care for patients because they're allowed to receive early diagnosis and also proper treatment. This prevents the spread of the disease, and also the rest of the ER can focus on patients with other emergency conditions.
In scheduling, there have been certain ERs that have tried mathematical graphing methods in order to schedule out their employees throughout their shifts. This also includes scheduling out certain specialized occupations throughout the shifts in order to have an equal amount of each specialized occupation throughout the schedule.